This last 8 months, as the coronavirus has insidiously embedded itself throughout this province, we have become used to the daily statistical updates, and we hear the high numbers of those who have tested positive or admitted to hospital, those who are in intensive care, sadly those who have lost their battle against this deadly virus, and over time we can lose sight of what this. Earlier today, Michelle and I met with a young woman called Rhonda Tate, and Rhonda and her 3 sisters lost their mother, Josephine Brown, last April, and briefly, here is her story.
As a person, my mummy was fun. She was fun, she was so loving and caring. I wasn't expecting the doctor to say to me, there are possible COVID symptoms. Once they closed the door, that was it. Out in the street, watching the ambulance driving away. I just wanted to go and hold her hand and to hug her, for her to hug me. You know, that hug from your mummy always made everything better. And I knew when my phone rang, sorry to tell you that your mummy's passed away. I haven't to tell the 3 other sisters. Our wee mummy, our life, the heart and soul of our family, dying in hospital all alone. You're not hurting anybody by wearing a mask or washing your hands or social distancing, so just do it, you know. It could save so many lives.
So Rhonda is taking part in the next phase of our public information campaign, and it's a key element of our overall strategy, and it's vitally important that everyone knows how best to protect themselves during this global pandemic. And I do welcome the recent NISRA research, which shows that we are connecting with about 95% of people through our communications. Since March, our information campaign of Stay Safe, Save Lives has been seen or heard over 261 million times, with the average adult seeing or hearing adverts 174 times. And as Rhonda told us today, she simply wants everyone to follow the public health advice and save lives. Across hospitals, residential homes and other healthcare settings, our dedicated medical and social care teams are battling for every mum, dad, daughter, son, brother and sister as if they were their own. And on behalf of the Executive and the people of Northern Ireland, I want to express our gratitude to all those who have put their lives on the line in the service of others. And it is fitting, as we look towards Remembrance Weekend, that we reflect and remember the sacrifices made by all those men and women in uniformed services across the generations. As they have protected us during difficult times before and will do in the future, it is right that we do all we can to honour them and be respectful of the current guidance. Today in the Executive we have considered a range of medical and scientific evidence, and it is clear that over the last 3 weeks of restrictions, your efforts have gained us important ground. We have seen significant progress on transmission rates and other measures. The number of new cases has dropped, and the estimated R rate in the community has fallen to around 0.7. The Chief Scientific Advisor has indicated that for our local government districts, a majority of council areas have already reached rates of 0.7 or below. However, the number of patients requiring treatment in our intensive care units remain high, and the proportion of older people contracting COVID has been increasing. So there is still more to do to ease pressure on our health service and to save lives. We have 1 week to go with our current restrictions, and we are asking people to redouble their efforts. We've learnt that footfall in Belfast city centre over the most recent week has decreased by 57% compared to the same period last year. Attendance at workplaces is down 44%. And while helpful in fighting the virus, the economic impact is enormous. The Economy Minister advised the Executive that this 4-week short, sharp intervention will cost our local economy £400 million. And we recognise that £1.5 billion has already been provided in Northern Ireland through furlough, the Self-Employment Support Scheme and the Department for Economy Hardship Funds. And we welcome today's further announcement by the Chancellor in relation to furlough. I do want to say a particular thank you to all of those business and organisations who've been affected by the current restrictions. We acknowledge all the hard work that you have put in to keeping customers and staff safe. There has been a significant investment and innovation across all sectors, and we are committed to continuing to work in partnership with you so that we can ensure we find the best and safest way to live with the presence of the virus. The Executive has had a comprehensive discussion this afternoon on what measures may need to be introduced from the 13th of November when this current package of enhanced restrictions come to an end next week. Those discussions will continue, and we will intensify our engagement with the hospitality sector representatives as we seek a safe and sustainable way forward for that industry. We want to be able to make announcements at the earliest possible opportunity to provide businesses with certainty and allow people to see the plan. Now, we know that positive change is coming as our work advances on our track and trace systems, the advent of new treatments, and of course the development of effective vaccines. These will all feature in our ongoing approach as we seek to coexist alongside the virus. For the immediate future, we must all do everything we can to continue to protect lives and livelihoods. We ask you to keep to the public health advice and limit contact with others outside your household, maintain social distancing, wear face coverings, and ensure good respiratory and hand hygiene. If you develop symptoms of COVID-19, self-isolate and book a test, and download the Stop COVID-19 app. It is welcome to hear this week that we are now over 500,000 downloads. These are currently our best weapons in the fight back against COVID-19, and we thank you for your patience and encourage your ongoing compliance with the measures in place as together we continue to battle this virus. Michelle.